Hello again and welcome back to 90 Day Dental Day 40. So today we've got a special edition session on dry mouth, and that's a great topic to be talking about with one of our main sponsors being Oraleave, and a very relevant topic related to their products, and also something that a lot of us could do with a fantastic reminder on. So without further ado, let's crack on with Jackie. Take it away.
Hello everyone, I'm Jackie. I'm a practicing dental hygienist, and I also work for Oraleave, who do dry mouth products. So I'm hoping everyone that's keeping really safe and well at the moment in these strange times we find ourselves in. I'm passionate about improving dry mouth condition for our patients. I'm here to talk to you today about dry mouth and the impact on our patients. We need to be helping our patients to manage the condition, and if we do, they will thank us for it forever. So before I started working for Oraleave, I never really asked my patients, do they have a dry mouth? It isn't always something that your patients will think to report to you, as it is a very subjective condition. I was surprised that when I started asking my patients, how many patients actually said, yes, we do suffer. So what is a dry mouth? So it is caused when the body doesn't produce enough saliva and the mouth feels dry. And we do know that an abnormally dry mouth occurs when stimulated salivary flow rate is less than 0.5 ml a minute. So what saliva does exist can become quite sticky, stringy, could be ropey, could be viscous, frothy. The sufferer may have trouble talking, swallowing, they can feel more thirsty than usual. Some symptoms that they may report can include sore gums, lips, tongue, quite a severe halitosis that they can get, painful tongue, cracked tongue. They may have trouble with loose-fitting dentures, so with retaining their dentures, and they're more prone to sort of frequent mouth infections, so that could be oral thrush, mouth ulcers, things like that. They can also find that their taste is altered, so they can taste differently. They might identify with a burning feeling in their mouth or their throat as well. So lots of different things that patients can experience with the condition. So how many patients do you see with a dry mouth? And it might be that in general practice, you don't really see many patients that do report the dry mouth, but it might simply be because if it's very mild, we might not be easily able to identify it, and we might just not be asking our patients the right questions in order to determine the condition. So in terms of prevalence, dry mouth is research has shown that it affects 1 in 4 people in the UK. Anecdotal evidence suggests that this is actually much higher, and we are finding that more younger people are affected as well, and this is sometimes down to pharmacological approaches to chronic conditions. So it does affect women slightly more than men, and it is a condition that does affect 40% of people over the age of 65. So lots of patients needing our help out there. So some causes of dry mouth, and there can be some obvious causes. So things like dehydration, anxiety, nervousness, smoking, alcohol, caffeine consumption, and also things like hormonal changes such as the menopause are all associated with a dry mouth. But polypharmacy is the primary cause of the condition, and we know that over 1,000 commonly prescribed and over-the-counter medications are associated with dry mouth, so that it is listed as a side effect. And the incidence does increase with the number of medications that are used. So with 3 or more medications, there is a 50% increased risk. And we also know that specific medical conditions can lead to suffering from a dry mouth, and those could be things like diabetes, Parkinson's disease, liver and kidney disease, and we've got things like the autoimmune conditions such as lupus, and the more obvious one, Sjogren's syndrome, all leading to potentially causing a dry mouth. So some classes of drugs that cause a dry mouth, and some may be more obvious than others, and some that we really do already know about, such as the tricyclic antidepressants. But we have lots of patients that are taking high blood pressure medication, and closely linked with experiencing a dry mouth. So we have antibiotics, antihistamines, we have lots of hay fever sufferers at this time of year. Gastric medications, lots of patients are taking those, our asthma inhalers, pain medication, drugs used in treatment of cancer, chemotherapy, and treatments for Parkinson's disease as well. So many drugs potentially causing our patients a problem out there. And then we have some other patients to think about. So we think about patients that are perhaps snorers, so they're mouth breathing overnight. And as we know, salivary flow rate diminishes overnight anyway. So patients just a little bit more at risk of dental problems with that. Patients that are on CPAP machines for sleep apnea, and those patients that are on oxygen ventilators as well, very topical at the moment. With lots of very, very sore dry mouths on ITU at the moment. We've been sending lots and lots of samples in to help improve comfort for those patients at the moment. Asthma inhalers, we've got just those patients that might generally feel more thirsty than usual and might assume that they're dehydrated, might not assume that they're actually suffering with a dry mouth and just notice that they're visiting the toilet perhaps more often. And so we have patient impacts can be physical or psychological for our patients. And here are some sort of common complaints from our patients that suffer. So they can wake up in the morning with their tongue stuck to the roof of their mouth, and they can quite often feel like they're choking with it as well. Their mouth is dry seconds after taking a drink, it's dry again. But their problems are worse towards the end of the day, and they can over-rely on chewing gum as well. So the impact of dry mouth really on our patients is that we do know they are at increased risk of caries and periodontal disease. They're more prone to sores in the mouth. They may really have trouble with their dentures, and they can result in impaired taste, troubles with chewing and swallowing without drinks, so particularly sort of very dry foods, and trouble with speaking for sort of long periods of time. So identifying our patients with a dry mouth, and it's really, really critically important that we do identify the condition of dry mouth in our patients. It can be a very debilitating, distressing condition, and so we need to be empathising with our patients as well. We can risk assess our patients. So we can, firstly, as we do, look at their medical history. We can look at the medication that they're taking, and perhaps if we do notice that they are taking 3 or more medications that we do know to cause a dry mouth, we can ask them the question, and chances are that they will say, yes, to a degree, my mouth is dry. So just being aware of those causative medications as well, having them there in the back of our mind. And then when we're doing our soft tissue check, so our intraoral examination, we can look for various things in the mouth that can identify the condition clinically. So we can look for the consistency of the saliva, noticing if it's perhaps stringy, frothy, ropey, if it has a different appearance to healthy saliva. Is there saliva pooling in the floor of the mouth? Because there certainly should be in a healthy mouth. Look at how the tissues are they red and dry? Are they perhaps glossy? That's a common manifestation as well. Cracked, fissured tongue, that's perhaps attracting lots of biofilm. Very rough tongue, oral thrush, mouth sores. We might find that our mouth mirror really sticks to their cheek or their tongue. It's not easily peeled away. Again, we do need to obviously bear in mind that our patients can be nervous, so their saliva flow is reduced anyway. And in terms of caries, it can really, really affect the incisal edges of anterior teeth and along the gingival margins in patients with dry mouth. So if we're noticing that sort of caries pattern, we could be looking at a dry mouth. And again, with periodontal disease, if it's not consistent with the levels of oral hygiene that the patient has, and if there are lots of plaque and food debris around, and yet the patient appears to be cleaning quite well, alarm bells could be ringing. You might also notice changes in their voice as well, so maybe their voice is more hoarse than usual. So we can ask our patients 4 critical questions, of which the answer of yes has been clinically validated to identify 75% of all dry mouth sufferers. So we can ask them, does your mouth usually feel dry? Do you regularly do things to keep your mouth moist? Do you get out of bed at night to drink fluids? Does your mouth usually become dry when you speak? We can ask our patients those 4 questions. And how can we help our patients with a dry mouth? And we certainly should be doing all that we can to recommend helpful things to our patients in order to help them manage the condition. So the role of the dental team, really, we need to identify the dry mouth first, and then we need to educate patients to the potential impact. Patients will not be aware that they're more at risk of caries and periodontal disease, so we do need to alert them to that fact. Can recommend saliva stimulants to improve their saliva flow. Not suitable for everybody, but if they do have some gland action there, then particularly conditions like Sjogren's syndrome, we can recommend that for them. But if they've lost sort of a salivary gland function, then perhaps they've been through radiotherapy for head and neck cancer, then that's not always going to work for those patients. We can recommend saliva replacement to help them manage the symptoms and just provide comfort to just really improve their quality of life. Really important. Oral hygiene instructions, and we need to be making sure that they're brushing 2 to 3 times a day, using their floss and their TPs twice a day. Regular monitoring, so ideally that's every 3 months with the hygienist and at least every 6 months with the dentist, and looking for the use of extra topical fluoride to help. So we might be putting them on a Durafat toothpaste, recommending an alcohol-free fluoride rinse for them daily. And then look at treating any adverse side effects, so any oral thrush that they might be getting that needs to be treated, and looking at the role of their medication in all of this. So we want to be encouraging them to speak with their GP to see whether perhaps they could be changed to a different medication, or perhaps their dose could be altered. So in terms of saliva replacement, the Oraleve range, making dry mouths happy again, which it certainly does. So the Oraleve range, we have a range of products, a unique combination of bioactive ingredients, which include the natural enzyme system of saliva. So they seek to replicate what saliva really does in the mouth. And they contain xylitol, which, as we know, helps protect against dental caries. Very mild in flavour, really, really important if a patient has a dry mouth or a burning mouth. Strong mint flavours can be quite irritant to the tissues. And they are sodium lauryl sulfate and alcohol free as well, and they can be prescribed for patients, which is a really, really convenient thing as well. So we have a few different products. We have a gel, a saliva replacement gel, which can be used overnight, and that can give up to 8 hours relief for patients. It can just give them the quality of that uninterrupted night's sleep, really important. And then we also have a spray and a rinse that they can use during the day to help freshen the breath. We have a toothpaste and a mouth rinse, both containing fluoride. So the patients can use the whole range of the products, which is really, really important. It's very confusing for them out there with all the products that are on offer. So Oraleve products are available through Oraleve Direct on their website, also through Amazon and through Lloyd's Pharmacy. The feedback that we've had from the products has been really good. Patients say that they're very, very good in flavour, very mild in flavour, and they do hang around in the mouth, so they do give that long-lasting relief. Oraleve would love to send you out some patient samples when practices are back up and running. So please do email them, hello@oraleve.co.uk. You can also email me, Jackie@oraleve.co.uk. Anytime after this talk today, I'm very, very happy to answer any questions that you might have. Thank you very much for listening, and do keep safe and well, everybody. And Oraleve would love to be in touch with you soon. Thank you.
And this concludes our periodontal section for 90 Day Dental. And brilliant session by Jackie and a really nice succinct update. Moving on tomorrow to a completely brand new topic. I'll see you all then. Take care.